This job was done by Elsa Leipzig. She's a fellow in Paris in surgery, and we do traditionally for more than 20 years in case of peritonitis after appendicitis with a cancer inside the appendicitis or an abscess. We consider that the tumor is broken because usually the appendix is open or the surgeon do surgery and take 2 or 3 parts of the appendix. So of course the surgeon don't know that when he performs surgery for an acute appendicitis. And after 1 week, 2 weeks, 3 weeks after, the pathological report arrive and this is adenocarcinoma. So the question is what we have to do in that situation. The standard treatment for appendix adenocarcinoma is a right colonic resection. But in case of suspected peritoneal carcinomatosis because of broken tumors, open tumors, we discuss to put more cytoreductive surgery and HIPEC. That means perform the right hemicolectomy, but perform omentectomy, cholecystectomy, and an HIPEC procedures for this case, even we don't see any carcinomatosis. So a sort of prophylactic situation to decrease the risk of peritoneal recurrence. So Elsa do a first follow-up of cases that have been operated in my own centers, so monocentric study. And it seems to be interesting because we have only 1 case of recurrence in peritoneal carcinomatosis and more than 10 cases with no recurrence. But it was monocentric study. So today we have presented a national study. So we find touch with all the centers in France that perform cytoreductive surgery and try to collect the same case. For some, they have been operated with a right hemicolectomy, like an appendiceal cancer with not T3 or T2, and other cases have been operated with the same ideas by other centers, prophylactic treatment of the peritoneal risk, cytoreductive surgery, and HIPEC procedures. And we see what happens to the patient, and clearly it seems to be better to receive a prophylactic surgery in that situation with a prophylactic HIPEC, because the result seems to be different. The recurrence is 30% if you don't perform any HIPEC procedures, but it's very low if you perform an HIPEC procedures. So this is not a prospective randomized trial. This is a retrospective trial, so there could be many bias, but it seems to be possible to decrease this risk of peritoneal recurrence in a specific situation. Of course, it's not frequent, and more, half of the cases that we have seen that have been operated for appendicitis, when they arrive to the tertiary center where they are operated for right hemicolectomy, half of the cases have carcinomatosis. So in that situation, of course, HIPEC is a standard treatment for this case. But we rarely think that in case of situation when there is a high risk with perforated adenocarcinoma of the appendix, HIPEC and cytoreductive surgery could be very important for the patient.